Imagine being in the hospital and being told that you need life-saving medical treatment, but your first thought is, how will I afford this? Sadly, for millions of Americans, this is their reality. Getting sick means more than dealing with the problem at hand. It also means facing expensive medical bills, insurance limitations, and delaying care, even life-saving care, because of the cost. Health care is a basic human right, yet access to affordable health care is not guaranteed for everyone. The United States should establish a universal health care system to ensure that every American has access to medical care regardless of employment or income. 37 to 40% of countries globally, around 73 to 78 out of 195 nations, have established a formal universal health care system. However, because many of these are populous nations, roughly 69% of the world's total population has access to some form of universal coverage. Now let's talk about the United States. Studies estimate that roughly 18,000 to 45,000 working age Americans die prematurely every year due to a lack of health insurance. Uninsured individuals face a roughly 40% higher risk of death compared to their insured peers. The increased mortality rate is driven by delayed diagnoses, unmanaged chronic conditions, and the inability to afford life-saving medications. These are human beings that are suffering. No human should experience this. Proverbs 31 verses 8 and 9 commands us to help those in need. It states, "Speak up for those who cannot speak for themselves, for the rights of all who are destitute. Speak up and judge fairly. Defend the rights of the poor and needy." Uninsured people frequently skip routine care and cancer screenings such as mammograms or colonoscopies. Cancers are often caught at a much more advanced, untreatable stages. If those people had access to health care, chances are they would have a higher survival rate because cancers would be caught early, which typically can mean a more positive prognosis. There are conditions such as hypertension, diabetes, and heart disease that require continuous monitoring and medication. Lacking regular care leads to unmanaged spikes that trigger fatal strokes, heart attacks, or kidney failure. Because some people do not have access to health care, they tend to skip medications or skip routine checkups. Then ER visits become the default for their care, which is far more expensive and less effective than regular management. Also, preventative tests such as blood pressure checks and A1C tests can catch problems early, but people will put them off simply because of the high cost of health care. Now I want to talk about prescription drugs. High out-of-pocket prescriptions costs have forced individuals to skip doses or split pills such as insulin, leading to acute, life-threatening metabolic or cardiovascular emergencies. According to the Institute of Medicine, a report was released in 2002 that estimated 18,000 adults between the ages of 25 and 64 died annually due to not having access to health care. According to the National Library of Medicine, a study published in 2008 said more than 26,000 Americans ages 25 to 64 died in 2006 because they lacked health insurance. More than twice as many as were murdered, Families USA said. In the 7 years from 2000 to 2006, an estimated 162,700 Americans died because of lack of health insurance. Cardiovascular disease or heart disease is the #1 cause of death globally in the United States, claiming hundreds of thousands of lives each year. Imagine how many fewer lives it could potentially take if people had access to health care in order to save their lives. We all know that mental health issues continue to be on the rise. We see the effects of this every day when you turn on the news or in our own personal lives. Mental health and physical health go hand in hand. They're closely related. Early intervention is key in diagnosing and treating mental health issues as well as physical issues. Healthcare should not be something that people have to choose between getting seen by the doctor or putting food on their table. Universal health care would give every American access to the care they need without the fear of financial ruin. The question is not whether America can afford universal health care. The question is whether we can afford to continue a broken system where millions of people cannot afford to be healthy. It's time for the United States government to make health care a human right, not a privilege. Thank you for your time.